ketogenic diet is a low-carbohydrate, high-fat diet that offers many health benefits, including weight loss, improvements in metabolism, blood sugar and insulin function, as well as brain and neurological well-being. And while most people do well on this type of eating plan, transitioning to keto from a carb-based diet can be a challenge. Here is Dr. Dom D'Agostino, a neuroscientist and ketone researcher, sharing his thoughts on how to start a ketogenic diet.
It's much harder to go from eating a normal diet to overnight on, study day number 1 to go from eating like 300 grams of carbs to under 25 grams of carbs. It's very difficult to do that and then sustain that. Typically what happens is that the first week to 2 weeks, you get a lot of drop off. So, over time, we realize that it's much better to ease the patient in, and you don't need a ketogenic diet to get huge, remarkable, improvements in insulin and blood glucose and all these inflammatory markers. I mean, simply reducing carbohydrates from 200 or 300 grams a day to 100 grams of fibrous carbs produces like a remarkable effect, and you're not excluding a lot of phytonutrients that would, be associated with a very strict ketogenic diet, a medical ketogenic diet, for example, that's used for epilepsy. So we think we want to have a more liberal diet and optimize it. But conversely, if you do a very strict ketogenic diet, the weight loss comes very fast. And sometimes patients like that. First, you have to look at the diet you're currently following and figure out, what the context is very important here. So are you just wanting to lose weight or control your glycemia, reduce your insulin? So typically what's needed for people is to establish a calorie deficit. And it's easy to lose weight, but it's much harder to sustain that weight loss. So the dietary approach that a person should take to improve all metabolic markers, typically most people need to lose weight, should be a dietary approach that includes foods and a variety of things that they would stick to. So my recommendation would be to just simply restrict your carbohydrates and you'll be amazed at some of the profound metabolic changes you'll see. And it will make your body more metabolically flexible. So many people who just follow a standard American diet or a standard diet from any country, their physiology is adapted to burning carbohydrates almost exclusively. And you can actually measure this with a metabolic cart. It just basically shows, looking at O2 consumption, CO2 production, that they're burning primarily sugar and carbohydrates. But if they just, start restricting their carbohydrates, maybe occasionally doing intermittent fasting a few times a week, then they will start shifting their physiology to burning more fat and will increase their metabolic flexibility over time. And then they'll start to see some favorable changes in body composition alterations, I think, and also their mental health will likely improve. And these seem to parallel favorable changes in biomarkers.
As with any significant change, it pays to plan your transition into keto in advance. Choosing a variety of foods that you like means that you'll be more likely to stick with and succeed on a ketogenic diet. Don't be in a rush to get into ketosis. It's more sustainable if you gradually cut back on your carbohydrates over time. You'll also be less likely to experience keto flu. Begin by reducing your carbohydrate intake to 100 grams of fibrous carbs per day. These include vegetables such as cauliflower, broccoli, cabbage, Brussels sprouts, and green leafy vegetables. To assist your metabolism, you may want to consider incorporating intermittent fasting. A common approach is the 16-8 method, which involves skipping breakfast, eating within an 8-hour window, and then fasting for 16 hours. You can start by trying this twice a week. Over the next week or two, your body will start to become more metabolically flexible and adept at shifting between burning carbs and fats for energy. After a couple of weeks, if you want to adopt a standard ketogenic diet and enter nutritional ketosis, reduce your carbohydrates to between 20 and 50 grams per day. And don't forget to include plenty of healthy fats such as olive oil, avocado oil, and fatty fish. Lastly, MCT oil can provide useful nutritional support by rapidly converting to ketones in the body, helping you to enter and maintain ketosis.